so I've walked into the scene is safe. I'm wearing the appropriate PPE, which in this case is gloves. I'm then going to explain the procedure to the patient and then gain consent. So have you had an ECG done before? No. Okay, so what it is just checks the electrical activity of your heart. So I'm just going to place some stickers on your wrists and your ankles. Is that okay for me to do?
Yeah, that's fine.
Excellent. So in a normal ECG, obviously obtaining patient modesty, we would expose the chest. I'd also prepare the skin so you don't have any moisturising cream on your wrists or ankles. If the patient did, I'd just use an alcohol swab and wipe it with a towel. So these were able to stick on there. For the purpose of this assessment, we're just using this ECG machine. So it's just a 12-lead ECG machine, but I will just be using the 4-limb leads. And just before I do that, I would also place in the patient's details, their date of birth, first name and last name. Okay, so this one goes on your right arm. This one goes on your left. One goes on your left leg. So really the right leg is just for grounding purposes. It doesn't really show up. Okay. So just lay nice and still for me. So I've encouraged the patient to lay nice and still, and I'm just going to wait for the rhythm so there's no artifact. So I'm obviously making sure there's no electronic devices, so mobile phones, smartwatches, anything like that. On this machine, just press print, and it will start to analyze the rhythm. Because this machine needs to then send it on to cardio scan, so I'm not going to be able to print an actual ECG strip out, but this is one that I prepared earlier. So according to that, the patient is inferior STEMI. Okay, so therefore I'm then going to proceed on to do a 12-lead ECG.